And then when this happened, at the beginning, I couldn't believe it. When the people called me to say they stole the samples, I was like, what? Why?
Welcome to the third season of Transmission, the podcast of the Institute of Tropical Medicine in Antwerp. This season, we follow our researchers in their ambitious pursuit to eliminate and control diseases that threaten the world. In the final episode of this season, we look to the future with hope. From groundbreaking tools and new ways to control mosquitoes to the rise of research all across the world. And maybe these breakthroughs and our teamwork will make the dream of disease elimination a reality. Transmission, your front row seat to the world of health, science, and beyond. In a small town on the outskirts of Lima, Peru, a little girl struggles to see the world clearly.
I remember my little sister, she had cataract. She was born with that. And I remember that because we were living in that small town, she couldn't be diagnosed until she was almost 6 years old.
This is Francesca Falconi.
Here in Peru, we have these asentamientos humanos, which are poor areas in which people just establish there and start like a very small town, right? Yeah, I grew up in this small town because my parents, they were working in agriculture, and I experienced firsthand the struggles of getting healthcare in living in low-resource areas.
Francesca and her family, like so many others, faced barriers to healthcare. The town's only health centre was often without a doctor, leaving even simple diagnoses out of reach. All the while, her sister struggled. And
then my parents have to come to Lima, and then finally she could get diagnosed of that, and she need to have a surgery for correcting that. So this is just one example, but it's quite the same for any kind of maybe disease or something that you have. Sometimes because you live in a small town in which the access to healthcare is very little, sometimes it's very difficult to get like a diagnosis at the time that you needed it.
Experiences like these drove Francesca to her research.
Well, since university, I always knew that I wanted to work in a topic that could help people with low access to care. My interest for tropical disease increased because most of the tropical diseases are neglected.
Today, Francesca is a microbiologist in Peru. She's an ITM alumna and works on the front lines of global health. Her mission? To improve diagnostic tools for one of the world's fastest spreading diseases, dengue. A promising innovation she's working on now is a test capable of detecting multiple viruses at once, including dengue, Zika, and chikungunya.
It's also in collaboration with the ITM in Antwerp. It's not only for diagnose one arbovirus, such as dengue, but it allows the detection of 4 different viruses at the same time.
This approach significantly reduces diagnostic time, enabling quicker responses during outbreaks, because typically a sample is tested for one virus after the other.
We run a test for dengue, and that takes like 4 hours. And then if it is negative, we say, it could be Zika, and then it's another 2 hours. And then, it's negative, it could be chikungunya. Okay, another 2 hours.
The new test could prevent situations like that and give quicker and more accurate results. We need this test because diagnosing dengue isn't that straightforward. The disease has symptoms similar to other infections like Zika, chikungunya, yellow fever, or malaria.
So it's very difficult for the physician to establish a diagnosis based only on the symptomatology of the patient.
Without proper diagnostic tests, treatment gets delayed and complications increase. But tests are not a given in low-resource settings. In the region where Francesca lived, for example, patient samples must often be sent to central laboratories in Lima because the tests need trained personnel and sophisticated equipment. Consequently, people don't receive their results when they need them.
Normally, they could be lucky that have the results in 5 days, when normally the disease is already resolving. But sometimes it could take a month.
By the time the official diagnostic results are available, they are only relevant for statistics, not for the patients themselves. To address these gaps, hospitals in the more remote regions resort to commercially available diagnostic tests. While these tests provide quicker results, they lack the accuracy required for official case confirmation.
Because these tests are not approved by the government in order to confirm a dengue case, it cannot be counted as a register of cases in Peru. That's very problematic.
Francesca is trying to raise awareness by researching how well the tests perform, so she can inform the government that maybe during outbreak situations, these rapid diagnostic tests could be used by hospitals.
And that could be approved by the Minister of Health in order to confirm a case of dengue during outbreak situations.
The approval is important because dengue cases often go underreported, and that negatively impacts the amount of resources available for control efforts.
Because the resources that we are going to allocate is for a number of cases that is actually very lower in comparison with the real one.
As part of her PhD, Francesca set out to develop tests that are more accessible and accurate. Carrying out this research required several journeys deep into the Peruvian Amazon. The plan seemed simple at first: collect blood samples from dengue patients, transport them to a lab in Lima, and test for markers that reveal the disease. But nothing about fieldwork is ever simple. What Francesca didn't know was that her journey would be full of surprising twists and turns. To start off, she had to find people with dengue, which shouldn't have been hard in a country endemic with a disease, but...
When I started to collect samples, there were no dengue cases in the areas that we selected, of course.
She had to start over, finding new regions to study. Her work took her to remote villages.
By going there myself and directly be involved in the collection, it really also gave me the sense of what was needed for these people and how important it was for them to have a good diagnosis.
But the logistics of handling samples proved incredibly tough. Once they were collected, Francesca and her colleagues had to store them at -80 degrees centigrade in ultra-freezers to preserve the virus. Remember, we're in the middle of the Amazon without reliable electricity. To keep the samples cold, Francesca used dry ice, which maintains extremely low temperatures.
And we need to ship the dry ice from Lima to the Amazon and then back to Lima. We did that in different times, many times, during my PhD.
Every step required careful planning. It wasn't just science, it was a logistical puzzle. Amid these challenges, disaster struck when a shipment of samples never arrived. Francesca received a call. Her samples had been stolen.
When this happened at the beginning, I couldn't believe it. When the people called me to say they stole the samples, I was like, what? Why? I mean, the first reaction was, why they stole samples? What they are need for? That was really bad because they were very precious.
Then Francesca learned the shipping company also transported valuable items like electronics. The thieves probably thought the box with the samples carried something more profitable.
And this is something that I never contemplated at the beginning, right? When you write your project, you have to establish some risk that you might have during the conduction of your project. But of course, that my samples were stolen was never one of them.
Francesca had to go to the police station to report that her samples were stolen. There she received a document confirming her account of the incident.
And with that document, I needed to travel again to the Amazon, talking to the people, trying to explain them what happened.
Francesca needed new samples.
And it was very devastating for me at that time because I was already having some struggles from my PhD. It was really terrible at that time.
The stolen samples were not just any samples. They were from patients who had tested positive but had since recovered.
And because they are healthy, they say, yeah, but why do you need another sample from me? I'm feeling well. Why is that?
It's hard to convince someone who recovered from a disease and feels fine to give a blood sample, let alone a second one because you lost the first one. But Francesca wasn't ready to give up. Travelling back to the Amazon, she explained the situation to the communities, asking for their trust once more. The people decided to give her new samples of their blood.
And it was also showing me how if you explain how when you are open to the people, trying to tell them what happened and why you are doing this, they are very comprehensive. It was really amazing at the end. I was really, really thankful for all the participants that understand me, that this happened, and that believe me that actually this happened.
Despite these struggles, Francesca remains committed to her work on fighting dengue.
I would like to quote a song which is called Latin America. If you haven't cared about it, please do it. It's called Latin America and it's called by Calle 13. And it says like, my skin is of leather and that is why it resists any weather. So we are always breathing a struggle in Latin America. But we somehow manage how to overcome these problems and to continue with doing what we are passionate about it, which is specifically for me is working with arboviruses and doing research and working in collaboration with different institutions. It's really important for me.
Francesca works at the University of Cayetano Heredia in Peru. The collaboration between institutions like hers and ITM are key to the innovation efforts. Such partnerships not only enhance surveillance capabilities, but also promote technology transfer and capacity strengthening in low-resource settings.
For us, it's been very productive, I have to say. There are many people that follow a PhD or master degrees at ITM and that are now leaders in our institution, like having their own lab, running their own lab and being leaders in research. And I think something key about this collaboration is it is true collaboration.
In Latin America, researchers are sometimes too quickly seen as merely providers of samples.
You give me the samples and I do all the research here. But this is not the case with ITM. I think something important to mention is that they have always seen us as equals, like true partners, that we can do the research here in Peru as well as we can do it in Antwerp. And I think that's been key because that allows us to not only to grow and to gain more experience, but also that we are more prepared in order to be more independent in the future. So I have to say that this collaboration is very important. I think that specifically for me, I've never imagined in my life that, especially because coming from a small town, I never imagined myself like traveling to Antwerp.
And that's exactly where she ended up getting her PhD. Now let's do some travelling ourselves and take a moment to revisit the triangle introduced in the first episode of this season. This triangle consisted of three crucial components: the pathogen, the insect vector, and the environment. By diagnosing and treating the disease, like Francesca does, we are actively targeting the pathogen, which means the virus or the parasite. But focusing on just one part of the triangle isn't enough to stay ahead of emerging diseases. What about the insect vectors, like the mosquito? Understanding mosquito behavior is key to developing effective vector control tools. Enter ITM's state-of-the-art insectary. There, researchers are exploring the behavior of mosquitoes in controlled environments.
Yes, so welcome to our brand new insectary at ITM.
We listened to Ruth Müller, whom we met in episode 1 and 3. As an entomology expert, she's leading ITM's insectary. First, you'll be given a lab coat.
So if you come to our building, we will provide you first with some information.
You are not allowed to bring food or drinks, smoking is prohibited, and
you are not allowed to touch any door handle. We will enter the first door into the wet lab. And this is like an anteroom to the real insectary. So there is one door which will close behind you. There is an air shower. And then you go to the next door only if the first door is closed.
You now enter the secured laboratory, filled with various cabinets housing different species of mosquitoes.
And if we cross to the next room, you will see a device which allows us to observe the behavior of the mosquitoes. For example, the larvae, we can track them in this kind of microscope, connected microscope. Sometimes we put larvae together in a petri dish. They fight against each other. We can really measure this. How is the interaction of these mosquito larvae in a small water container? And then leaving this room again, we come to the next one.
You step into a climate-controlled room containing a large cage equipped with multiple cameras.
and there we can measure the behavior of adult mosquitoes in a larger space.
The room is set to simulate tropical conditions, complete with a light cycle and humidity levels. It also houses an olfactometer, a device designed to study how mosquitoes respond to different scents and stimuli.
This is a large device, an arena, where you can put a mosquito in the middle, and you have 4 ports where the mosquito can go.
In those ports, you can place various items ranging from flowers to insecticides.
And you can see if there's an attractiveness or is there a repellent effect on the mosquito.
The lab studies in the insectary complement the fieldwork, as Ruth and her team collect mosquito eggs, larvae and adults in the field to study their behavior and breeding patterns. But there are more insects to be found at ITM than mosquitoes alone. There is also a dedicated tsetse fly colony for research into sleeping sickness. We listen to Jakke van Den Abbeele, ITM expert on the parasite that transmits the disease.
In the basement of the building, we have a tsetse fly colony of about 3,000 producing females.
Those 3,000 females produce enough offspring to study sleeping sickness.
Tsetse flies are put in small cages, actually, of 30 females. So again, we have trays with a lot of cages in which the female flies are there, and they are productive. So they produce their larvae, they drop into some gutters.
Every day, a lab technician collects and counts the larvae.
Every day, all the newly emerged flies are separated, male and female.
Maintaining this colony requires a lot of logistics and meticulous care, and the flies need to be fed.
So we feed them on Monday, Tuesday, Thursday, Friday. So we have trays on which we can put 15 cages. On that tray, we pour 200 ml of defibrinated blood, bovine blood mixed with sheep blood or horse blood.
Over the dish of blood, a silicone membrane simulating human skin is stretched. The setup is then warmed to 38 degrees centigrade, and the cages with the flies are placed on the tray.
Normally, tsetse flies, within 5 minutes or 10 minutes, they go through the silicone membrane, they take up the blood and they are fed.
Jakke's work explores the biology of the sleeping sickness parasite in tsetse flies and in the skin of infected people, seeking answers that one day may lead to new tools and innovations for disease control.
So it's intriguing to put forward those questions and try to find ways to find answers experimentally. So that drives me, and it will not give solutions on the short term. It will not solve sleeping sickness on the short term, but maybe that knowledge, if you find out how the parasite is adapting, maybe there's a key molecule that you can interact with, you never know.
Ruth and her colleagues are also exploring a range of strategies in combating insect vectors. One innovative and more gentle approach involves boosting biodiversity by introducing natural predators like aquatic beetles.
We have not only a climate crisis, we have also a biodiversity crisis at the moment.
This crisis is closely tied to mosquito-borne diseases, as the absence of predators allows mosquitoes to thrive.
So, for example, our aquatic beetle populations declined during the last decades. Also, insect-eating birds declined in their abundance.
The idea is that restoring biodiversity to its previous levels can help regulate the ecosystem.
We found here that aquatic beetles are really good predators. So if we increase the ecosystem resilience, we increase the biodiversity of these aquatic beetles in our cities, in our parks, then we can also have a little effect on this Asian tiger mosquito.
Since these beetles are native to Europe, this innovation could offer a gentle and sustainable way to control mosquito populations in the region. One more tool in our toolkit. Fundamental research is an important way to prepare ourselves, as is improving public awareness and being ready to manage a disease and keep it under control.
It's also often not very well known in Europe that dengue exists, that this could be a risk.
It's all about getting to know the disease, the insect vector and the environment, and spreading that information to all involved.
I think preparedness is the best what we can do to prevent this increased public health burden, or at least to lower it to a manageable level.
Organizations like ITM are working hard to address the gaps between what is happening and what is known by the general public. They inform governments, public health sectors, and communities about the alarming signs of outbreaks, thresholds for action, and best practices for disease management.
We have to prepare ourselves in Europe for emerging mosquito-borne diseases such as West Nile virus, chikungunya fever, and also dengue disease.
So, let's take a look at innovations working on the final part of the triangle, the environment and the humans that live there. How does a disease like dengue spread? Traditional models of dengue transmission focus on households as the most important site of infection. However, during COVID-19, researchers saw something entirely different.
So when COVID started, we were in a big rise of number of cases of dengue. It was really the beginning of an epidemic.
This is Veerle Vanlerberghe, whom we met in episode 2. She's an epidemiologist at ITM, working on disease control and neglected diseases. Dengue was surging in Cuba, and on top of that, COVID arrived. The home had been identified as the primary site of transmission for dengue, but now everyone was being ordered to stay inside to protect themselves from COVID. Combine this situation with mosquito control programs taking a hit during COVID, and dengue was sure to rise tremendously.
So this was a prediction. This didn't happen. So people stayed indeed at home. There was less mosquito control, but there was also less dengue.
Against all odds, dengue cases dropped when people stayed home. The researchers and their models were wrong, and this led to new innovations and ideas. Now, Veerle is looking into the role of public spaces such as schools, markets and bus stops, where large groups of people gather during the day.
We had a wrong knowledge before, and now we have to study it and we have to see what the importance is of these places. Like in schools, if you have indeed a water container or a roof gutter which is infested, you have all the children who are there during the moment that the mosquitoes are most active. And these children then go home. So it will spread over your city if it's one school, and then it's spreading over your city because the children are going home.
Understanding these dynamics in dengue transmission helps illustrate how quickly a disease can take hold in urban settings. But while dengue thrives under these conditions, malaria follows its own set of patterns. For Anna Rosanas, the fight against malaria is not just a scientific challenge.
There is half of the world where children are still dying from a disease that can be prevented. And if you think about it, it's like whether you are born there or born here is such a lottery. So I think that living without looking at the other half of the world, it's not an option. It doesn't need to be like that. There's things that can be done.
Anna is a parasitologist and a malaria expert. Through innovation, collaboration and commitment, her dream of a world free from the devastating impact of malaria is becoming increasingly tangible. We listen to Halidou Tinto again, the researcher from Burkina Faso, whose team helped make the malaria vaccine possible.
Yeah, I think as a researcher, I'm very happy and proud with the advent of the 2 vaccines, knowing that I was part of this success story. Because as a researcher, the question you ask yourself every day is, what is the impact of my daily work on my community? Is it just to publish papers in the Lancet? To be promoted as a professor? No, this is not my main goal. My main goal is to make people more happy, more healthier, and knowing that your work contributes to achieve this goal of really sorting out the health issues of your community is what I'm more proud than the publication did. So I could say that I can retire in 10 years' time, very proud of contributing to change the story of the malaria disease. That is really the message I want people to keep from my career as a researcher in Africa. Knowing that I contributed to build in Africa one of the biggest clinical trial centers that will benefit in the future generation beyond me. The new generation of scientists and researchers will continue to work in this center and develop new tools and tackle other diseases, because all the effort, I'm pretty sure malaria will not be a problem in the coming 10 years. But we have other diseases, neglected diseases, still prevalent. And knowing that the platform I've set up will serve as a platform to really fight all these diseases. Make me really proud, and I'm pretty sure that will show how I was able to contribute to the advance of the African continent research on tropical disease.
We've already taken big strides to combat vector-borne diseases. Education and capacity strengthening have been at the heart of these achievements. Institutions like ITM have played a pivotal role in training scientists and providing the resources needed to conduct research.
I used to tell people that if I didn't have a chance to pass through ITM, I will not be where I am today. To be honest, I was able within 10 years to launch about 37 PhD training. And so far, 16 have completed their PhD across Europe, Netherlands, Belgium, South Africa, even in the US. And most of them are back. And those people are those who are currently in the field conducting all the trials.
By equipping local researchers with the skills and tools they need, these initiatives ensure that progress is rooted in the communities most affected by disease. We edge closer to a world where preventable diseases no longer claim lives. The journey is far from over, and the task is daunting. But with the innovative tools and knowledge at our disposal, the dream is closer than ever before. And while the fight against malaria continues, researchers like Halidou Tinto are already preparing for future challenges, like antimicrobial resistance.
We have a very limited number of drugs, and if we are not able to protect them, we'll get in a real disaster in the future. The next challenge of Africa after malaria will be the AMR, the antimicrobial resistance.
Ambitious as always, Halidou is already laying the groundwork to tackle this challenge. But that's a story for the next season of Transmission. Thanks for listening. If you enjoyed these episodes, make sure to check out the first 2 seasons of Transmission, devoted to outbreaks and health systems. From early encounters with Ebola in distant villages to the challenges of getting medicines to war-torn countries, the 2 seasons tell tales of resilience, discovery, and humanity under the most challenging circumstances imaginable. For more information about the Institute of Tropical Medicine in Antwerp, visit itg.be/podcast.